An excludes one error in plain English is when two diagnoses on the same encounter conflict with each other. So what we've seen from excludes one rules is a lot of times there are two diagnoses that are similar in nature, or maybe they mean the same thing. And when they both are on an encounter together, for example, tonsillitis and sore throat, those two are conflicting. You should choose the more appropriate diagnosis that patient should be diagnosed with and include one on the encounter and remove the other one, and that will lead to a cleaner claim. Excludes one denials catch so many teams off guard because so many payers are introducing more claim edits for excludes one. In the past, a lot of times excludes one issues on encounters just slipped through the cracks. There was no way to catch those, and a lot of payers weren't doing anything about those. They were not catching those and denying those claims. But in the last year, we've seen an uptick in the amount of payers that have turned on claim edits for excludes one errors. And with that, some health systems are seeing $5 million in denials from one payer in 1 month just for excludes one issues. In my experience, the providers are adding diagnoses to their encounters, and as they add those diagnoses, sometimes if you say a patient comes in with a sore throat, they initially add that sore throat to the encounter. Maybe they run some diagnostic tests in the office and then they figure out the patient has strep throat or they have tonsillitis and they add that diagnosis to the encounter. Those are conflict in diagnosis or excludes one issues. They will be added to the encounter there. As that encounter goes through the process of being billed, a lot of times on the back end, we have coders or revenue cycle staff that catch those issues before they go out the door, and then they're tasked with fixing those because they know a lot more about coding rules than the provider knows. The real operational cost of failing to catch excludes one errors before a claim goes out the door is it's going to result in a denial often. So what we've seen this past year is a lot of payers have really increased the edits that they're doing for excludes one errors. We've seen a couple of payers just in the last month turn on some of these edits that are causing a lot of chaos in a lot of health systems as they're trying to catch up and catch these edits before they go out to the payer and result in a denial. The changes when excludes one issues are caught pre-bill is you've got a clean claim going out the door. So that's the benefit of our solution. We enable the coders to be able to catch those issues before that claim goes out the door. There's no risk for denial then because you've caught that claim before it goes out the door. It's a clean claim, and then you hope that's going to just get paid and have the revenue coming back in.